We're going to go ahead and get started. I just want to welcome everyone who's joined. We have more than 30 people joining us today. My name is Rachel Lucy. I serve in a community health role for PeaceHealth, and we're here today as a group of partners, SeaMar and Unity Care Northwest and PeaceHealth. We started talking about 3 weeks ago and realized how important it is that we reach out to the community and share more about the various virtual platforms that each of us are using for telehealth visits and here in Whatcom County. And we ourselves had imagined that there's a number of questions, and we want to give you some of the tools to best support, especially seniors. That's really our focus for today. But certainly this is applicable if you're helping a child or a spouse or a partner through a telehealth visit. I think you're going to pick up some great skills, and certainly usable for you personally. Just a couple of things for Zoom etiquette. Today we have muted everyone in the audience. So if you're unable to speak, that's the reason. Questions are welcome at any time in the chat window. Please participate, and also if something's really resonating with you, you can clap your hands or raise your hand so we can call on you. This call is being recorded so we can share with others following. One thing you might consider doing is setting your view to speaker view. That'll place the speaker in focus, as well as any of the content that we're featuring. Lots of introductions coming into the chat window, and certainly all of us as co-hosts are taking a read through that so that we have a good sense of who all of you are here working with and what some of your questions might be today. I just want to double check with my partners in crime. Can you all see what we're sharing? Yes, okay, great. So one of the things we realized—
Hallelujah, thank you.
Hallelujah, right? One of the things we realized as we were prepping for this is there are some similar tips no matter which of the virtual health platforms you're using. So if you're a patient or you're working with a patient of a PeaceHealth or SeaMar or Unity Care, there are still these great tips for preparing for a virtual visit to have the most success. Just like we prepared for the call today, having notes ready in advance, a list of topics that you want to talk about with your provider is a great place to start. Making sure you're in a quiet, private place so that when you're on video, you can have that privacy. Great reception and internet connection, and that's huge. And we know in Whatcom County that not all areas have that. So being aware of the strength of your internet connection and reception is huge. If you need an interpreter, we can provide one, and that's really important to know that families cannot serve as an interpreter. And then lastly, make sure your device is fully charged. So nothing worse than getting halfway through a visit and then powering down or realizing your power cord is halfway across the room and you can't quite finish your visit without running out. So those are our tips on how to prepare for a great visit. We're going to take you through 3 demos really briefly, about 5 to 10 minutes max per organization, and then we're going to open it up to Q&A. So we'll go ahead and we'll get started. So I want to welcome Sal joins us from PeaceHealth, and Sal's going to share his screen.
Good afternoon, everyone. My name is Sal. I'm a training specialist in PeaceHealth Medical Group. So I'm just going to quickly do an overview of our telehealth video visit. So I just broke it down to what is our telehealth video visit, how does it work, where do we begin, and let's try it, where I'm going to show you almost like a actual video visit where I am the provider and you are the patient, and then some questions and answers later on. So the telehealth video visits are secure, patient-centric visual care visits that use a HIPAA-compliant Zoom platform. New and existing patients have the option to schedule a video visit of an in-person office visit with their PeaceHealth clinician using their My PeaceHealth account or by calling the clinic to schedule. So this is taken from our our website. This is just a screenshot. So no matter where you are, PeaceHealth cares for you. So they're basically able to have a video visit appointment in the comfort of their home with just a device such as a mobile device, a tablet, or a computer, and of course a good internet connection. And in our website, there's a nice, good about 2.5 minutes of how to schedule a video visit. And there's convenient options. We have the urgent care, which is you can schedule a time slot for the same day. You can also have a primary care and also a specialty video visit if you want to plan to schedule a visit in the future. And we really want to make it very easy for the patient. We want to say we'll be with you every step of the way. So once the patient schedules, they will have a reminder via their email to log into their My PeaceHealth account. And in there, they can complete their e-check-in. And in their e-check-in, they can complete a few questionnaires, their medical history, the medications, and more. And prior to the actual appointment, about 40 minutes, they will receive a phone call from the Zoom Nuance hotline just to make sure that they don't have any technical difficulties, such as pop-up blockers, audio or video, just to make sure that they have a very smooth appointment. And then about 10 to 15 minutes prior to the scheduled appointment, our clinical staff will contact the patient just to make sure, just as they would when they check in the front desk. And you'll have constant reminders in your email just to make sure what you need to prepare for the actual appointment. And this is just a snippet of what it looks like in the provider side. So sometimes the provider will show their screen to show them, okay, your diagnosis, your medications, and instructions prior to the after visit summary. Okay, let me just switch this one real quick. Is my other screen showing or just the, let me see, a second, stop share.
Thanks, Sal. We can see the picture of the brain.
Perfect. So pretend you are the actual patient and I'm the doctor. I hope we're not going to have about 26 people in our actual visit, but pretend it's just you. So the nice thing is the Zoom platform looks exactly how we're doing it right now with way less people, but the provider can share the screen. They will share, let's say, in this case, like the brain, let's say your concern was your headache. So your doctor may show instructions on how to care for your headache, and at the same time, how to take care for your acid reflux. And they may also say they'll place an order, for instance, a Nexium. Once they select the Nexium, they'll talk to you about how much to take. So I'm just gonna go ahead and select a number. They'll also most likely say, if they do prescribe, they'll tell you your pharmacy. And once they do that, they'll do the follow-up. So once they say, okay, looks like you're all set. Let's take care of that headache and your acid reflux. And they may also show your after visit summary. So prior to ending the visit, they will discuss the proper care for your concerns. And then once the visit is done, this after visit summary will automatically go to my PeaceHealth account, and any follow-ups that needs to be done, just like a typical appointment in the office. And is there any questions?
Great, thank you so much, Sal. We're gonna loop back to the PeaceHealth platform with questions after we wrap up the next two demos. So we're ready for the next one.
All right, I've lost Erin here.
Rachel, if you're ready to go ahead with Unity, we could jump to you and then I can track down Erin for us.
Okay, sure. I can do that. All right. So first, before I jump in, my name is Rachel Herman. I'm the other Rachel on this call. And I am the Medical Operations Manager for Unity Care. And I just wanted to give a quick shout out to Rachel, Lucy, and Dan Lackey for really igniting this idea and pulling us together and coordinating all this. I think this is a really wonderful turnout. I love to see the representation from West Regional Council, and I'm excited for the questions and everything at the end. And excited that we as Unity Care were able to really organize ourselves in the midst of COVID and everything else that was happening, and get this launched, get this available for our patients so we can continue to provide access and care. I've got a few slides, and again, these are from kind of the patient's perspective, and hopefully some tips or tricks if you do have patients that you're working with or residents that will help facilitate a smooth visit. First of all, we do have really 4 departments outside of internal departments outside of Quest Laboratories that we also have on site: medical, dental, behavioral health, and pharmacy. And all of our departments are doing some sort of service that provides, kind of remote access to patients. In medical and behavioral health, we've got video conferencing and telephone visits, which make up our telemedicine program. In dental, we're able to provide telephone triage for services. Our dental program did take a pretty big hit in just kind of our approach and things we had to adjust with COVID. And we are just starting to ramp up services and identify ways we can safely provide dental care for patients and our staff. Our pharmacy was really exciting. We've launched curbside pickup and also a free delivery service. And throughout the slide deck, I've got some phone numbers that patients can call if they would like to enroll any of those services. What types of services are we providing? This, of course, isn't an exhaustive list, but I did want to provide just kind of a general sense and give you context for what kind of services are able to be provided through telemedicine. And you'll notice there's a little asterisk by rashes. As you can imagine, that can be difficult for a provider to do via telephone and or even video conference, depending on location of the rash, as well as quality of video. However, providers will do an initial consult if that's needed to happen, but they may request that the patient come in for services in person. For our behavioral health, what was really fascinating is that we actually flipped, and nearly all of our behavioral health services are provided via telemedicine. I think the last count, it was about close to 96%, which is quite dramatic. And we also have it set up where if patients do want to come in in person, but are concerned regarding potential risk of exposure to environment or that kind of thing, we have a telemedicine room that they can be in and still see their provider. And then, as I mentioned, we're providing telephone triage services for dental patients. How to schedule appointment, we really wanted to make this as simple and easy as possible. So for medical, behavioral health, and dental is just as simply calling one main number. And our scheduling staff will be able to help folks get scheduled, and I'll go through what they can expect during that process in following slides. And then again, for pharmacy, curbside pickup or delivery, for further questions regarding that, we have an on-site pharmacy in our Bellingham location, and then also in our Ferndale North Whatcom Health Center. This is a little bit of behind the curtain look at some of the questions that our scheduling staff will review with patients when scheduling for a telemedicine appointment. There are a few things we want to make sure the patient has, which is been reviewed a little bit at the start of the presentation by Rachel, which is, you know, access to internet, a smartphone, tablet, or computer with a camera. And in addition, we do a brief kind of the platform that we use, that it is HIPAA compliant and that kind of thing. Because we kind of we'll do a video conference or telephone. We do ask the patient if they would like a link to the video conference via email or text message, or if the patient doesn't have any of those options available, we will do the landline phone or smartphone call. This is just kind of continuing scheduling questions. I wanted to make sure they're big, so they got on a couple slides. If your patient has any medical equipment with them, we'll want to make sure that we get that information documented. And then other key things that we let your patients know, which is just, you know, to make sure they've got a list of their medications or even just their medications on them, so that we can get that updated as well. A little bit about our platform. We use a platform called doxy.me, and it is secure. It's compliant telemedicine platform. No sessions are recorded. Everything is encrypted, and nothing is stored. And as I mentioned, we are able to do video conferencing or telephone using that platform and or a smartphone or landline. The one caveat for the platform is that it unfortunately does not work on Internet Explorer. We do need to use Chrome or Firefox as the web browser for that. There's no app to download or special software needed to use Doxy. It is a free web-based, cloud-based service. And this is a brief description that we'll go through on, you know, how does Doxy.me work for the patient. The patient is sent, as I mentioned, a secure link via text message or email. And then when they click the link, they'll be directed directly into the virtual waiting room. And I think there is actually, I counted the links, there's maybe 2 to 3 clicks before they're actually in the waiting room ready to see their provider. This is an example of both the text message and email links that they'll receive. On the left-hand side, you can see the text message. It'll say, hello, this is, it says my name here, but it'll say their primary care provider they'll be meeting with. And or if they get an email, this is the one thing that is important that we really try to express to patients, because this is where we could run into the dreaded, you know, it's in your spam mailbox. They are looking for an email, not necessarily from UnityCare, but a no reply at doxy.me. The subject line will say telemedicine meeting invitation from, and then their primary care provider. The body of the email is right here on the right-hand side. And again, they just click that link and then they're entered to the check-in process. And the check-in process is relatively simple. They type in their name and they click check-in. So if they have their camera enabled, it's really just 2 clicks and then they're entered into the waiting room. If they don't have their camera enabled, or if we need to have access, it will automatically bring this on the right-hand side, step 2. And all they need to do is click enable camera, and they'll be able to get a picture of them, or we'll see their video. And then this is what they'll see. They'll be able to see a picture of themselves, and then also, you know, just a quick welcome message that their video will start soon. In the virtual waiting room, they're also able to test their system, so they can test the sound or video quality and that kind of thing. It's a really simple click-through process that Doxy will run them through. And please excuse these pictures. I realized that I didn't get screenshots yet, so I had to do these pretty quickly. But this is now in the visit. This is what they'll see. Their provider will show as a large picture, and then they'll show in the upper right-hand corner themselves. If they hover over their video, they can adjust things like turn their microphone on or off, turn their camera on or off. They can switch views, so if they want to see a larger picture of themselves and a smaller picture of their provider, they're able to do that as well. We do have a few safety protocols, and I know this is a pretty wordy slide, and I apologize for that, but I did thought that I would just share, you know, the exact script that we go over with patients. Because this is a virtual visit and they're not on site, we do have fairly specific safety protocol as well as privacy considerations, and of course tech troubleshooting that we review. For the safety protocol, we do address, you know, any suicidality, if there's intent to harm themselves or someone else. And we work to get their specific location, just in case there is potentially a medical emergency that takes place during the visit. We can send emergency response directly to the location that they're in. Privacy considerations. What's been really fascinating with the emergency response regarding the COVID pandemic is that there's been multiple rules surrounding telemedicine that has been really relaxed. And one of them is that the patient can really choose the location that they're in when they're receiving their visit. And it's no longer necessarily needs to be in a clinic site or that kind of thing. And so we really, however, we want to still stress the importance of confidentiality. And so we review with the patient that it is important that they're in a secure location, that they're in a private location, that they will be on video, their provider will be able to see them, and they'll be able to see their provider. And then because we're dealing with technology, and we all know how fickle that can be at times, we try to just have a tech troubleshooting plan. And it's really just, you know, we'll try to log in, you try to log in again. If we can't connect within 5 minutes, then, you know, give us a call and we'll reschedule your visit. And that's just some brief contact information for myself. That is my direct phone number. So if there's any questions or concerns that arise, please feel free to reach out. Again, the phone number for scheduling a visit, and then those pharmacy phone numbers too, if anyone would like to enroll in that delivery program or learn more about the curbside pickup. I've also included our website down at the bottom. We have, of course, lots of information and videos. If patients are also just curious what to expect in regard to coming to the facility and what may have changed in our response to COVID. I also welcome feedback. Again, this was something that we had to get launched really quickly, and we are constantly improving our process. So I'd love to hear if anybody have had patients that have gone through a telemedicine visit and has any feedback to provide too. That would be wonderful.
Great. Thank you so much, Rachel. Nice job. I think we're all learning something as we're going through and hearing to some of the nuances of this. So on Rachel's prompt, this is a great time to pop into the chat window and please post to everyone, especially if you've had experiences that you want to have shared, or if you've had a chance to look over a client's shoulder and to see, one, what's gone really smoothly for them, or make comments on what you've heard, or if things have been really challenging. That's also something we would like to hear. I'm going to do a quick check to see if Aaron Ignac has been able to join us from SeaMar.
Yes, I am back on the call.
Hi, Aaron. I was just looking to find your name on there, but it doesn't show up. So we're going to let you try to screen share, and we'll go to the quick demo from SeaMar, and then we'll circle back to questions.
All right, I am not back on Zoom, so I am just going to have to do this verbally. I apologize. Good afternoon, everybody. As Rachel just said, I'm Aaron Ignac. I'm the County Administrator for SeaMar Community Health Centers. And as Rachel from Unity Care just mentioned, technology can be fickle. So my laptop froze up at the exact wrong moment. So I'm just going to walk through some of our complementary information from SeaMar. Our technology is the same as PeaceHealth. We use Zoom as our platform with patients. We have purchased an enterprise-wide encrypted version of it, so it's got a little more HIPAA protection to it, and it meets those compliance requirements. We also use the same patient portal. Actually, it's a vendor called Epic. Ours has a different brand, a different flavor to it, but it's basically the same interactive online portal for patients. Like Unity Care, we provide telehealth for our medical, behavioral health, and dental services. Medical also includes a lot of our ancillary services such as nutrition, health education, care management, things along those lines. So we can do the vast majority of our services via telehealth, which is great for especially our most vulnerable and high-risk populations these days. As was said, we make sure that the patient knows that there are privacy protections, and then for their privacy, unless they have someone that's their advocate or guardian, we don't want someone else being their interpreter as part of the process. We really do offer anything that doesn't require physical touching or in-person services by our providers. So, general health concerns, parenting questions, sinus infections, even, with our health educators, smoking cessation, and how to cook better for diabetes management. All of that, those services can be done over our telehealth process. Behavioral health, again, like Rachel mentioned at Unity Care, we've gone completely online for those services, but it is the full menu as well. So it's individual therapy, group therapy, family sessions, mental health assessments, substance use disorder sessions. All of that can be done and is done via telehealth. Dental, we are currently only doing by telephone as opposed to video conferencing in Zoom. Our dentist did not find up close and personal views of someone's mouth to be overly beneficial, so we are only doing phone consultations for dental. Very much as has already been said, to set up a telehealth appointment, patients just call our normal clinic line, or they can go through our online patient portal at SeaMar. We call it My Chart, so any existing patient has access to that as well. We've already talked about some of the ways to prepare, having questions, being ready. We give a reminder call the morning of the scheduled appointment. Our medical assistants will then call ahead of the appointment time and do the virtual rooming, so to speak, and then the patient stays in the virtual exam room, and then the provider joins, as has already been described. Some frequently asked questions that we get from patients that you might want to pass on to some of your residents or the populations that you're working with.
Not the whole time. Oh, I'm sorry. Didn't have to.
Patients do not need a Zoom account. Since we're sending the link, they just access through ours. There's no cost to Zoom for them. Patients are asking if we're going to bill for the telehealth appointments, and we do. As Rachel from Unity Care just said, some of the rules and regulations around this because of COVID have adjusted a little bit. So if they have insurance, we will bill that. If there's copays, they'll be in charge of copays. They do need to download the Zoom app if they are going to use the video component of it, because we would need access to their device's webcam. And then since they don't need their own account, if they don't want it, they basically just follow our link, and then we provide, when our medical assistant calls them, we provide the link to their specific online access, and we go from there. One of the things that we, in closing here, one of the things that we really want to emphasize is making the patients comfortable and heard, and making this a beneficial offer and a resource for them. So at any time during the telehealth visit, whether it's phone or video, if they are more comfortable to not be doing it in this medium, then we can definitely readjust our approach as well. So we just make sure some of those considerations are expressed up front, because we don't want someone to get into something they're not comfortable with, or it's just not working for whatever reason. But everything else is basically the same as what's already been described. We, in the peak earlier of COVID, we were doing about 85% telehealth, and now it's about 50-50 at SeaMar. So there are definitely patients that still want it and find it very helpful, especially those with transportation barriers and so forth. So it's working well, and we're going to continue doing this, and that's basically the additional information I wanted to share anyway.
Great, thank you so much, Erin. And we were able to share the screen for the website that SeaMar's put together. So that was displayed as you were talking. So glad to have you.
Thank
Sorry
you.
about the internet. This is Rachel Lucy again, the other Rachel. We want to open it up for questions, and we've already got a really great one from Joni. Joni asks, is there a way to have a recording of the virtual visit to share with like a home care attendant or a family member who also can be supportive of the information they learned? Anybody want to take that one, or know if that's possible?
Sure, this is Erin from SeaMar. We explicitly do not allow recording, just for HIPAA reasons. If anyone else knows of a way to still meet that regulation, I'd be all ears as well. But SeaMar does not currently allow for the recording of the televisits.
Right, and that's the same for Unity Care. I will say that the after visit summary, if the patient has a portal account, it's automatically uploaded to their patient portal. And so it can be accessed through there, or if they don't, then we do mail it to them. And so that can also be, it'll be provided to them and could be reviewed with their attendant.
Yeah,
it's
good point.
the same with PeaceHealth as well. Because of HIPAA, they could not record, and what happened in the visit will be in the after visit summary and in the secured portal.
Great, thank you, everybody. Okay, how about some other questions? What else do people have on their mind? And I can pull a couple from what we heard also in the pre-registration questions that people posted in. One of the questions is, how do we support those, or how have we seen support for those with dementia and Alzheimer's? This is probably a bigger question because the individual asked about especially inpatient visits and how that coordination looks between hospital visits and clinic follow-up. Anybody want to take that? And then I'll go to the next one in the chat window. I think we might have identified that might be a trouble spot. And I think some of you may be aware, I can speak a little bit on behalf of the hospital. Just as of this week, I believe our visitor policy has been relaxed a bit. So there's certainly more access for those who are accompanying a family member on an inpatient visit. And then certainly internally for those inpatient visits, we have the staffing and have had to really look at our staffing to make sure we can support those who are here, especially with dementia. Great. Other comments or questions? We'd love to hear your feedback. So if there's anybody who in the audience who's willing to maybe just share about either a personal experience or working with a client on telehealth visit and how it went, we'd love to hear what worked well or what were the sticking points.
I see there is a question, I think it was from Heather, about the functionality of having a family member or other support person join the telemeeting from another computer. That's a really great question. We do have that capability, and we can send the link out as well to another family member.
Great, thanks for catching that one.
In PeaceHealth as well, the family member can have the link. They could either have a two-way video, or they can be in the same room as a support person. And in phase 2 of our video visit, we may have like a second provider if it's like a specialty consult or so.
Correct. And at SeaMar, we do the same thing. We just make sure that we are sending the Zoom link invite to the patient specifically, and then they can forward that on. We don't offer it unless there's, a guardianship or, attorney directive. So we give that to the patient, just like the after visit summary. Once we give it to the patient, they can share it with whomever they deem appropriate.
Great. Erin and Rachel and Dan, I'm posting another question, Sal, in the chat window. This was posted before our session today. If a patient has skin lesions that are suspicious for cancer or skin to hair staging, what's the quality of the HCP able to make a diagnosis from the computer monitor camera or other such ailments? When does the PCP make the decision to have the patient come into the building? What factors into that?
Yeah, if it's a high risk patient, we will definitely set up the telephone or televideo appointment first, and then the PCP can be assessing, not necessarily via the webcam of what the injury looks like, but can be doing the assessment at that point. My hunch is that if it doesn't come through clearly, that we would want an in-person follow-up appointment from there. But we could definitely start with telehealth to confirm that.
Yeah, that's the same process with community care.
I don't think I'd have much else to add. Having worked in dermatology previously some years ago, skin lesions are best confirmed through biopsy. So while they can look at them and probably make a quick assessment, it's highly dependent on quality of video and just the camera and lighting and settings. So it's just one of those things that, like Erin said, could be looked at and then to determine a further course of treatment post-video visit.
I'm just thinking, one of the things we wanted to hear was just how's it going, and is there any way that our 3 teams, and I know FCN, Family Care Network, if they were here as well, they would say the same thing. Is there anything we can do to help with outreach, especially inside of senior living facilities? I know we have Josh is here from Eden. We have some other folks. Here's the one from Home Attendant Care. Lots of folks from Northwest Regional Council. If one of you, maybe we start with Josh, could go off mute and even just share with us a little bit about how we could be of support, or if it's going seamlessly, let us know that too. I have a hard time believing that's true, but.
Yeah, actually, I mean, overall, what our role has been at Eden Home Health is we require face-to-face visits for bringing folks onto service, and what we've really found is in most cases it's when folks don't have the ability, they don't have a tablet or they don't have a phone. We've been able to provide tablets to those folks to be able to kind of act as their camera. But overall, I mean, the speed at which most of the providers have been able to set folks up with the telemedicine visits has actually been really great on our end. So, I mean, I don't have anything real dramatic to say in kind of a negative aspect. I think it's been really great, and we've been able to actually service a lot of patients that would have kind of normally been stuck at home. And so I think overall from our perspective, things have been going pretty well, but if I think of anything, I can definitely post it down there in the comments too. So.
Great, that would be wonderful. That's so exciting that you guys are able to provide the tablets. That's wonderful. Anyone else? Mike, are you raising your hand? Perfect.
Yes, thanks. Mike Hilly, the EMS manager for the county. You know, I saw a demonstration of the telehealth advantages up at the skilled nursing facility in Linden. I don't think they any longer use that, but you know, it's a pretty high fidelity machine, a great HD video with you know, better than a phone camera. Actually, you could hear heart tones, measure blood pressure, see EKGs through this system. And what impressed me about it, the reason I really wanted to look at it, was because of, you know, unplanned transfers or people that get sick in the facilities at night, you know, get transferred to the ED. And I wasn't able to see numbers from the facility, but there was a reduction in some of these sort of semi-emergent transfers to the ED at 2 o'clock in the morning, because they can bring on a PA and a physician at that moment to make an evaluation and make a better plan for that patient. And so I just saw some great efficiencies in that. EMS is interested in exploring this as well in the community, because we feel like we can divert some of the calls out of the 911 system with a telehealth type of setup. Where they come in the 911 system, we could divert that call to a nurse line, and then that nurse could actually have a telehealth visit with that patient, you know, on scene. And if we needed to get a provider out there, then we can kind of do that in a scheduled way with the right type of provider, as opposed to sending a fire truck and an ambulance over there and 8 people on a call. So, well, we're really interested in that as well. And I've seen some great efficiencies just for the hospital side of making better decisions as opposed to going to the ED. So we like to explore this.
That's great. Okay, and let's see. So it looks like we've got another question from Melinda. So the comment here. The only thing we've had a hard time is setting up for residents who don't have an email address. Yep. I know it's possible because Dr. Sugar's nurse was able to do it, but others haven't been able to do it. This is good feedback. We've had that actually with our Doxy platform as well. And I'm not sure if there's issues with the link or if people are trying to open it on Internet Explorer, because again, it won't work on that. It's got to be opened with Chrome or Firefox. And sometimes that requires copying and pasting the link into the web address. But it's something we've encountered, and we're working with the vendor Doxy to try and troubleshoot what can we do on our end and what maybe they can do on their end to help that.
And this is Dan. Becky, can you speak to that maybe a little bit too? Because I know for the video visit appointment, we do have to have a My PeaceHealth account, but we were looking at doing some different things in the home health setting. Is that correct?
Yeah, I'm not sure about for the assisted living setting yet. I know in some of the skilled nursing facilities that we have at PeaceHealth, we've utilized a different platform with utilizing Microsoft Teams instead of through the My PeaceHealth account. But just with, you know, privacy and other kind of stipulations, we haven't really been able to explore that yet on the assisted living side. You know, on the skilled nursing side, we're already contracted, you know, providers with them, but yeah, still work in progress.
Thanks.
Yeah, and at SeaMar we can get to that around an email address because we don't necessarily require them to have a My Portal account set up. So when our MA calls the patient, we can provide the link meeting at that point.
So I see another question come in from Katie. So SCN has a clinical home team that offers home visits from an ARMP for special homebound patients, or any other PCP offices considering this service. So I can speak for Unity Care. We don't have this service right now. We do work closely with the GRACE team in Whatcom County, and they have an RMP that will provide all sorts of services, and they're just fabulous. We've been grateful to utilize that service.
Great. And I think, Melinda, I think I might know what you're touching on, but correct me if I'm wrong. You said potentially that not having an email might have been more of an issue on, was it on our end as clinics and not understanding the backside of how to set up by just creating a username? Yes, she said. Okay. Thanks, Melinda. And that's, I mean, I just want to just commend everyone on this call. I mean, I think each of our clinics and all providers in Whatcom County, we did about a year's worth of go live work in a matter of weeks. And so certainly the processes didn't necessarily catch up always among our teams, and our teams have just done an amazing job as well. But we always need the feedback, and that's why we finally have slowed down enough to be able to connect and hear how it's going. Kate posted something too. Kate, are you willing to share with the group? Are you able to go off mute and just comment about the experiences? You had shared that there's been some mixed results.
Yeah, I think many of my clients are they're older and not very familiar with technology in the first place and are pretty apprehensive about it, would like to have a family member present, but isn't always possible for that, as well as having trouble seeing and hearing. And all of those things combined with not feeling well is maybe not the best time for them to undertake some brand new thing like this, where they feel sort of incompetent and frightened in the first place. So I was wondering if there's maybe some way people could practice. I don't know how that could be, but someplace where they could have sort of a opportunity to try things when they feel better, or they have somebody with them to give it a shot and maybe write down directions for themselves or something. Just a thought.
That's a great, I'm making a note because I think that's a great idea. Yeah.
Yep, agreed. Yeah, I'll take that back to my clinical operations team.
One of the ideas we were tossing around, and we'd love if anybody has thoughts on this, especially if you work at a senior living facility. We were even toying with the idea of like, would it be helpful if there was like a little cubicle in some shared space where people could drop in and there was like a monitor like pre-set up. So we will share all of our email addresses at the end of this call up on the screen. If that's something you have interest in pursuing, or it could serve a larger kind of cohorted population, we'd love to speak with you about how we might be able to kind of do that kiosk or cubby type model with support.
Rachel, it's Dan. I was also going to say with Zoom, I think there's a way to quickly test the video and audio feature on the platform once they have the application downloaded. So that could give them a, yeah, so I'll just put in the link, but it does allow everyone at least to kind of get a quick baseline of what the platform might look like to log in.
Great, and Amy posted for the group that Family Care Network also uses DoxyMe. So we have basically DoxyMe and Zoom are probably your two primary platforms here in Whatcom County. And both of them have that option to practice logging in ahead of time and building that comfort before you're in your scheduled visit and feeling the pressure. I want to give one last call out, shout out for any questions or frequent last questions or things you want or hoping you'd walk away with from this virtual call that we may not have touched on. If you have those, you can either go off mute or post in the chat window. And then we'll do a quick summary and wrap up. Okay, I'm not seeing any more questions in the chat window. I want to just give Rachel and Sal and Erin a chance for any last closing comments. Sal?
No, if there's anything else that we can help, just reach out.
Yeah, I would say, yeah, feedback is welcome. You know, we're continuing to assess. We're kind of through that immediate, urgent implementation phase and trying to look at longer term how we can maintain this and keep this as an option and convenience for our patients. I think this is something we've been wanting to do for a long time, and we're getting on board. So.
Very similar with SeaMar. You know, this is an option. It's a resource. It's not going to fit for every patient in every situation, but it does help break down some of the barriers that we've seen in terms of getting patients to the clinic. And you know, our providers love their patients and they want to see their patients as much as possible. And if this is the way to do it, then that's where we're heading in our operations. And like Rachel said, want to do this for as long as possible.
Thank you all. No better time to schedule a visit than now. I don't know about all of you, but I have definitely have a little more access to time on my hands, and getting kids in and parents in for well visits are super important right now. We've posted our contacts for additional outreach. Dan's email, Erin and Rachel's email are all up here. We really do encourage you to reach out to us, even if you have an idea or something came up on today's call and you want to see if we'd be interested in pursuing in a collaborative way with you. We're going to make these this recording available probably early next week. We're also going to put together just an email to all of you that attended and even people who RSVP'd but maybe didn't come today. That'll include our resource links, and additionally, please feel free to forward that on to other people that you think might benefit. And just a huge shout out and thank you to everyone for joining today. Thank you.